Our presentation today is on attention deficit hyperactivity disorder, also known as ADHD.
What is ADHD? Attention deficit hyperactivity disorder is a disability in which an individual shows signs of one or more characteristics: inattention, hyperactivity, and impulsivity. It is common among school-aged children, where approximately 1 or 2 in each class have the disorder.
What causes ADHD? Attention deficit hyperactivity disorder is viewed as a neurological-based medical condition that occurs in the genetics at birth. The two specific genes that are affected are chromosomes 5 and chromosome 11.
What are the characteristics of ADHD? ADHD is organized into 3 categories: inattention, hyperactivity, and impulsivity. Students who are inattentive have difficulty focusing on any one thing and might become bored with the task after only a few minutes. They often ignore details, make careless errors, and lose or forget things. Students who are hyperactive show high levels of physical activity and almost always seem to be in motion. They often fidget and squirm and move about the classroom at inappropriate times. Students who are impulsive have difficulty curbing their reactions and often do not think before they speak or act. What is the diagnosis of ADHD? A physician is required to make the diagnosis of ADHD, and traditionally its diagnosis and treatment is managed without the direct involvement of the classroom teacher. Recently, parents and teachers have been invited to provide input and work with healthcare providers to develop and manage treatment plans for students with ADHD. Symptoms must be present for at least 6 months in 2 or more settings, such as school and home. Must result in significant impairment in social, academic, or occupational functioning, and exist to a degree that is maladaptive and inconsistent with the student's developmental level. Here is a list of the symptoms.
Intervention strategies. There are 2 types of intervention strategies for students with ADHD. Behavioral therapy. It teaches children skills and strategies to control their ADHD. It can help in managing behavior by establishing rules and routines, and focuses on desirable behavior and positive consequences. Medication. Some behaviors can be temporarily controlled using prescription stimulants. There are 2 types: psychostimulants and antidepressants. The most common use is Ritalin. The use has significantly increased since the 1990s.
What can teachers do? As educators, it is important that we must assist students in the best ways possible. Teachers should demonstrate an attitude of patience, flexibility, respect to all students, praising students for their efforts, and provide calming manipulatives for students to adapt to. There are some teaching strategies to use for students with ADHD. These teaching strategies consist of the 3 categories as follows. For instructional teaching strategies, it's important to provide oral and visual instructions, prioritize lessons to stay on task, and reward students for positive actions and choices. Environmental teaching strategy will require the teacher to use preferential seating and use a visual and auditory signal to get attention focus, such as a bell or a time clock. For assessment strategies, it is important that the teacher gives breaks during tests and allows for oral tests and scribing to occur, so students feel comfortable and more relaxed in their working environment. Famous celebrities who have ADHD are Karina Smirnoff, who is a Dancing with the Stars champion, and Justin Timberlake, who is known as a famous musician and actor. Other celebrities include Channing Tatum, who is a famous actor and dancer, and Adam Levine, a musician and member of Maroon 5.
Created using Powtoon.